whether you're a patient of ours or not, you'll probably find some of this information helpful. What we did was we just compiled a couple of questions that we get, more often than other questions. We get a lot of questions, but these are some of the more popular ones. And then this relates obviously to if you're a medical marijuana patient or a prospective medical marijuana patient in Florida only. So we can only speak for the state that we, do registrations and file prescriptions in, which is Florida. Hey, where are you going? Where are you going? Dr. Jenn, if you want to read the first question.
We often have people come in who have a lot of questions and just confusion about the whole process. Every state does something a little differently, so we get a lot of people coming from other states and it was done a certain way and they come here and it's completely different here. So, but one of the most common questions we get is it's always preceded by, I smoked a joint when I was in high school, or I smoked once when I was in college. Is the medical marijuana the same, and will it get me high? Probably the number one question we get. Mm-hmm. And it's not, you would think easy yes, no question, but it's actually not. Everything's so regulated compared to years ago when you got whatever you got. Now it's down to the milligram and the percentages and the strength. So you can really dial in exactly what works best for you. But just an easy yes or no question, if you use enough THC, yes, you will have psychoactive effects.
Yeah, and usually, so the conditions that we see, we see people after they've tried CBD from a gas station. It didn't work for them, so they need something medical grade. The stuff that works is psychoactive, period. That's the short answer to that. If it's going to help you with MS, yeah, it's going to be psychoactive, because the other thing it's competing with, are a host of strong medications.
Right.
If you want to compete with a host of strong medications, including painkillers and everything else, you need something psychoactive. So that's the short answer for that.
And in the state of Florida, they make us do umbrellas under like normal or high THC and low THC. Anything under low THC is considered a CBD product. So those are non-psychoactive. That's the one answer to this. That's no, that part will not get you high.
You can get medical grade CBD with a medical marijuana card. And it really just depends on whether or not, it's going to work for you. We can't tell you if it's going to work for you because the research is kind of all over the place. So it's a trial and error
Very much so.
type of system. You're kind of, the patient's in control of their own treatment after we register them for the card.
Probably the next most common question we get down here in Florida because of all the snowbirds and the part-time residents is, can I travel with it? Absolutely not if you're crossing the state line. There are two ways to actually get in trouble this way. One is if you go into an airplane where it's federally, federal jurisdiction, then it's illegal because federally it's still illegal. And two, if you're in a car and you cross state lines, then you've now gone into federal jurisdiction as well. So you cannot travel with it, even if the next state is okay with it. If you're going from Florida to California, you have to buy separate products when you're in California.
So third question is, can you grow your own?
Not yet.
No.
Not in Florida.
No. Can my buddy grow some and give it to me in like a little baggie? But since I have a card from my doctor says I can smoke weed, right? Can I do that?
If it is not in the container from a dispensary, then it is illegal.
Okay.
Any product that you get has to be in the container it received in for it to be legal. Also,
these are real questions that I get.
And as he was saying earlier, can I grow my own? Absolutely not, Florida. There's no gray area with that in Florida at all right now. Will there be in the future? Maybe, but as of right now, no.
And the laws tend to work really quickly.
They do. As of right now, the law is you cannot operate machinery within 2 hours of using it. So just be mindful of all the laws and stuff and grow with it, especially if you're one of the patients that are brave enough to come out here and get it here in the beginning.
We're going to do another video, which I'll link up top, and that's going to go over the difference between percentages of THC, difference between CBD and THC, ratios, These are all things you're going to see when you go to a dispensary. You're going to see them on the prescription. 75%, 30%, 1 to 4, 9 to 1. What does this all mean?
600 milligrams.
Click the link and I'll explain. We did a whole video just to explain that. Yeah. As for everything else, check back with us regularly and we'll keep you updated.